I'm Stephanie Bourque. I'm an assistant professor of pediatrics at the University of Colorado and Children's Hospital Colorado. And I'm here today to talk about parental engagement in the care of substance-exposed newborns. We know that this is of critical importance and spans from pregnancy to prenatal counseling, to labor and delivery, to the well baby nursery or NICU admission, during that birth hospitalization, and finally to discharge home and the transition of care to the primary care provider. Ensuring that parents are at the center of care throughout the entire process is key. Changing how these newborns are cared for in the nursery or NICU with the development and implementation of the Eat, Sleep, Console tool, the focus on non-pharmacological care, and when appropriate, encouraging breastfeeding, actively engages and empowers parents in the care of their infants. With a recommended two-tiered approach to treatment, first-line therapy has a primary focus on non-pharmacologic interventions, which include swaddling, on-demand feeding, and low-stimulation environments. As such, initiation of opioids and other medications are only recommended when non-pharmacologic measures fail. These strategies focus on keeping mothers and babies together whenever possible, with the goal of rooming in and increasing skin-to-skin time. Teaching mothers how to best console their newborn, how to feed, and how to be a constant source of comfort and security differs drastically from our previous approach of removing substance-exposed newborns from their mother's care and admitting them to the neonatal intensive care unit, where the ability to room in is limited. With this old approach, mothers may spend less time with their newborns and may feel unwelcomed or judged by hospital staff. Giving families constant and direct access to their babies in a quiet, low-stimulation environment allows for earlier response to hunger cues and prompt calming when fussy. Several studies have demonstrated an association between this technique and the decreased need for pharmacologic treatment, along with a shorter length of hospital stay. Despite these well-known associations, a recent survey of 76 U.S. hospitals noted that while some sites offer rooming in with parents during the initial observation period, 41% of hospitals never offer rooming in, and only 11% offer rooming in when an infant requires pharmacologic therapy. Supporting an environment for infants and parents to stay together when appropriate is key. Barriers do exist to consistent parental engagement during hospitalization and may include transportation challenges, other childcare responsibilities, intervention by Child Protective Services, off-site methadone dosing, and other residential substance disorder treatment requirements. Maternal support, including access to comprehensive mental health services, counseling, and treatment, along with eliminating judgment, can increase parental engagement in the newborn period. We know that parental involvement, in conjunction with other approaches, decreases the need for opioids and shortens length of stay. However, further evaluation of the impact of parental engagement throughout this process is needed. This includes evaluating parental perceptions of this approach and investigating the long-term impact of this approach on the whole family unit. Better understanding how parents can be engaged through this process is needed as we continue to optimize the care of substance-exposed newborns. For more information, please call us or visit our website.